Hello, welcome to Newscentre. I'm Parikshit Luthra. Health Secretary Rajesh Bhushan has said India was seeing an average of 966 new COVID-19 cases per day. That's significantly higher than the 108 cases per day in February. India has over 7,600 active cases currently. However, India's graph is much lower than the daily cases reported in the US, Russia and China. The Health Secretary said there is no evidence of higher hospitalization or mortality, adding that the government is prepared for any uptick. Also, the Prime Minister held a high-level review meeting on COVID-19 and influenza cases in the country. To discuss this further, we are joined by Dr. Vishal Rao, member of the Genomic Surveillance Committee of Karnataka COVID Task Force, and Dr. Vaishali Solao, Head Critical Care at Fortis Hospital. Dr. Vaishali, if I can begin with you. There has been concern about the rise in influenza cases, rise in COVID cases over the last few weeks. How concerned are you? How concerned should we be?
So, influenza every year does have a peak of cases, and what we are seeing now is also a similar peak. It happens every year all around the world. The H3N2 is the influenza virus, which is currently most prevalent right now. And the COVID also now, as per the Ministry of Health, is the number of cases are rising. Yes, it is a matter of concern, but not a matter of panic. People just need to take more and more precautions. And the only way out of this is basically more and more precautions and vaccination. So it is a matter of concern, but not a matter of panic. And easily precautions can easily avoid, can be taken so that people don't get it.
All right, matter of concern, but not a matter of panic. Dr. Vishal, coming to you, the XBB.1.16 variant, does it have the potential to trigger a new wave of COVID-19?
Thank you, Parikshit. For the last couple of, I would say, years, we've been tracking the virus, and the last couple of months has been very interesting to see the evolution of the virus. Two important points that come to light for us globally when you look at the data is that the recombination is a concern which every virologist and epidemiologist is concerned about, where two separate strains of the virus get together and lead to a new strain. The other important thing which we are worried about is antibody-enhanced disease, AED, which is leading to what is called as depleting quality as well as quantity of antibodies in us who have been vaccinated either twice or thrice, because we have been vaccinated with the first strain, that is the D614G of the virus. And what is happening right now is completely a new strain of the virus, which is a completely new version altogether. So at this juncture, the XBB 1.16 and again discussions around 1.9 and others continuously are happening, with higher rise in the spread and in the transmissibility that they're having. For example, in Karnataka, from Feb last month till now, there has been a jump from 1% weekly positivity rate to 3%, whereas the mortality rate has not changed. So while we are not concerned and we do not see any reason for us to hit the panic button, and we will continue to see new variants come up very regularly, we'll see new variants come up very commonly. It's going to be very crucial for us to monitor them to understand which one of them will reach a critical point to create infectivity like Delta. And when we say that there are some other important scientific facts, now the Omicron strains that we are seeing now does not have the access to the TRAMPus protein pathway, which the earlier Delta had, and that's why it was able to easily enter the lung. So we don't expect that there is going to be any kind of a sudden change in the biological behaviors of these new Omicron variants, because they seem to be infecting their nose and throat region and not the lung. And that's why we feel that we will be saved from the wrath of the problems like that we saw in Delta. But vigilance needs to be continued, and genomic surveillance is the answer, not only now for the COVID, but also, like Dr. Vaishakhi earlier said, for the influenza strains to keep monitoring their virulence. If we continue to do this, I'm sure we'll be very better, well prepared. Karnataka has already set up the Center for the Pandemic Preparedness. I think we are closely watching each and every new strain and their clinical behavior.
Right. Dr. Vaishali, we've also seen, and this is something that Dr. Guleria, the former head of AIIMS, also noted, that we've fallen back when it comes to testing and reporting of cases. Do you think this is very, very critical whenever there is a sudden spike in cases that is witnessed?
Testing is definitely required now that the cases are going up, and yesterday's guidelines have specified for the 6 states that we should step up the testing. So definitely testing is now required, and the 5-point program emphasizes on testing, tracking, and COVID-appropriate behavior. So yes, we have to step up testing, especially in the 5 or the 6 states which are showing a higher number of cases.
Right. Any particular precautions that we need to take, Dr. Vishal, as far as incoming passengers go? This is a year when India is holding the presidency of the G20. There will be a very large number of delegates, large number of VIPs who will be coming into India over the next 6 to 7 months. Any extra precautions that we should be taking at this point?
I think the amount evidence.
All right. I think we're losing that connection with Dr. Vishal Rao. Let's see if we can get him back on. But of course, the emphasis of this panel is on the need for great amount of testing, greater reporting of cases, and greater precaution as well. Dr. Vaishali, coming back to you, any extra precautions that you're advising your patients to take? And at a government level, at a state government level, what are some of the key precautions that we must take, keeping in mind that this is also the year of India's G20 presidency?
So at individual level, I would stress that the high-risk individuals, and those high-risk individuals are those who have obesity, those who have heart illnesses, those who have chronic kidney or lung or liver failure, or those who are immunocompromised, say, for example, HIV or are post-transplant patients. These are individuals who need to take more extra precautions at an individual level, try and avoid crowded places, use mask, do not touch your face with repeated face and eyes and nose with hands, use hand rub, keep your hands clean, and if possible, try and avoid crowded places. So high-risk individuals definitely need to take more precautions as compared to normal, young, healthy individuals. Now, as far as at the government level is concerned, I think yesterday's meeting is an example of how having learned the lessons, the government is running ahead of the entire illness and of the peaks, and appropriate steps are being taken. The people should actually just comply with all those instructions. And as the government emphasizes on COVID-appropriate behavior, the public need to take it seriously, need to wear the mask, maintain social distancing, and not have a behavior which will assist in the spreading of that virus.
All right. Thank you very much, Dr. Vaishali and Dr. Vishal, for joining us here, explaining us about the recent increase in COVID cases and what needs to be done in the days to come. Thank you very much, Dr. Vishal Rao and Dr. Vaishali, for joining us on this broadcast. We're going to take a short break here on Newscentre, but when we return, a Surat court finds Rahul Gandhi guilty of defamation in a 2019 case for targeting Prime Minister Modi for sharing his surname with fugitive businessmen Nirav Modi and Lalit Modi. Discussion when we're back.